Hello everyone, my name is Dr. Prajakth Binaike and I am going to demonstrate a rubber dam application on a single tooth, that is lower left first molar, for an endodontic purpose. Let's go. So to begin with, let's have a look at the armamentarium that is required for rubber dam application. This is a basic rubber dam kit. It has a rubber dam forceps, a rubber dam punch. These are different types of clamps. Few are for lower anteriors, upper anteriors, and few are for posteriors. Then we have rubber dam frames. One is of plastic, another is of metal. I personally prefer a plastic one because it does not create any troubles while taking a diagnostic x-rays in endodontic procedures. Then we have rubber dam sheet. It comes in two different sizes, 5 by 5 inches and then 6 by 6 inches. 5 by 5 is usually used for a pediatric patients and 6 by 6 is for adult patients. Then this is a rubber dam template. We may require some accessories. This one is rubber dam cord, floss. We may sometimes need Vaseline. This is a flowable dam that is called as a liquid dam, and few times we may need these wedges. This is a rubber one and this is a plastic one. Before we start doing rubber dam application, make sure that there is no any sharp edges on the teeth or any old restorations. Make sure that there is no any calculus, and also make sure that the gingiva is well anesthetized before we place rubber dam clamp, because sometimes it may pain. This is a rubber dam sheet. It comes in different colors and different thicknesses. It has two surfaces. One is a shiny one and another is a rough surface. Shiny surface is always towards the patient and the rough surface is always towards the operator. To avoid confusion, it is always advisable to mark any corner of the rubber dam sheet. I generally prefer to mark it on the upper left corner. So at the time of placement, it becomes easy for me to locate the corner. Then this is a rubber dam template. We'll place it over the dam sheet. Now our tooth of interest is lower left 6. So it's 1, 2, 3, 4, 5, 6. You mark it with a marker. So here we have marked the lower right, lower left 6. Then comes your punch. This punch usually has a dial with 5 to 6 holes in it. The smallest one is used for lower anteriors and the largest one is used for posteriors. In this case, we are using the largest one. You have to place this dam over the dial, stretch it and punch. So now we are ready with the dam. Many people, they prefer a overlap punch over it, that you can do it in this way. So this is our overlap punch on the dam sheet. This is rubber dam clamp. There are two types of rubber dam clamps. One is with wings and another is wingless. This one is with wings. It has two jaws, one bow, two anterior wings, two central wings, two holes and four prongs or beaks. One thing is very important to know here, that before you carry this clamp into the mouth, make sure that you tie a floss to the clamp. Now let's carry our clamp into the mouth with the help of forceps. Make sure all the prongs are well in contact with the tooth. Check for the fitting of the clamp. Make sure that The bow is always on the distal side, it is never on the mesial side. Then I have taken my dam sheet. You just have to stretch the punch hole that you have already prepared over the bow. Use your index finger to push it over it. Now on the buccal side, central wings, anterior wings. Then on the lingual side, you can also use any instrument. Make sure that instrument is not sharp. This way. Right? Then comes our frame. You just have to hold it like this. Stretch your rubber band sheet over the beaks of the frame on both the sides. This is our rubber dam in place. Few times you may need to use a liquid dam surrounding the tooth in this way. And just cure it for 10 seconds. That's all. So this is our rubber dam in place for a single tooth, that is lower left first molar, for an endodontic purpose. You just have to engage the beaks of the rubber dam forceps into the holes of the jaws, stretch it, and the entire assembly will come out.